Hello everyone, welcome back to my channel. So today I'm heading towards the oldest dental clinic of Arunachal Pradesh, which is located in Naharlagan. You can see the road condition is pathetic and our state is still in the stage of developing. Yes, this is the capital region. In yesterday's blog, I have placed an immediate dental implant. So in today's blog, I'm going to place a late dental implant. Slowly and gradually, I'll be teaching about dental implants in this way. So the patient is edentulous for the last 6 years. There's a history of bike accident. So the implant that we're going to place after 6 years is known as the late dental implant. Anything which is greater than 4 months after tooth extraction is known as the late dental implant. We do not have a CBCT in our state, so हम लोग RVG से ही चला लेते हैं. Extremely sorry for a very bad radiological picture, so in order to compensate. So the missing teeth are 11, 21 and 22. We are going to place 2 dental implants in 11 and the 22 region. I have decided to place the dental implants firstly at the 22 region, considering the surgical anatomy of the 11 region, because intraoperative bleeding chances are there from the incisive foramen region, especially when you are a new implantologist. So you need to be careful of that. So while placing dental implants in the 2-2 region, you need to consider the fact that the status of the 2-3 region is very important. The roots should not be tilted or the root should not be dial serrated. So you can see in the x-ray it is totally fine. The root is straight and far away from the 2-2 region. For placing a late dental implant in the lateral incisor region, I would always advise that do not place a dental implant more than 3 mm, especially if you do not have proper CBCT in your area. While if you want to know the surgical techniques of dental implant, I'll be attaching the link below in the description area of the surgical techniques of dental implant. It is just a 1-minute video, you can watch that. Now placing the dental implants in the lateral incisor region. So you can see that the torque achieved is 35 Nm and the speed is 20 RPM. The initial factor which is very important for the success of the implant is torque. Torque is nothing but it is the resistance of the bone against the implant while we are placing it. That is known as the torque, which is the stability achieved. Only after the stability is once achieved, and only then there will be the process of osseointegration. Therefore, torque and osseointegrations are very much important factor for the success of the implant. This is a 3 mm diameter implant with 13 mm length. The distance between an implant and a natural tooth, that is the canine in the adjacent side, should be at least 1.5 mm. Now starting with the central incisor dental implant placement. So while placing, you can see that I am doing the procedure blindly. I am placing a blind dental implant. I am not raising any flap. This is because the patient was diagnosed with typhoid. So he has just completed his medication 10 days back. Also, we have asked for the reference from his doctor. So he has cleared the reference and said that we can proceed for the dental implant surgery as all the blood reports were normal. I would still not suggest that you should go for a blind dental implant placement, especially if you are a new implantologist or if you do not have CBCT, because in my states we do not have any CBCT center here. I'm using a hand ratchet here to increase the torque, but I would suggest that you should not use a hand ratchet in D3 and D4 bone in the maxillary area. But again, as for my own comfort zone, and I just feel that I can take more control of the tactile sensation due to my own experience. So these are the 2 dental implants that I have ultimately placed. Had lunch with my seniors at Touchy Dental Care and then headed back home. Went back home, took some rest, and now starting towards my evening consultancy, which was a sudden consultancy. So I was supposed to go to the movie this evening, but then I got a call for consultancy, so I got to go. So now heading towards Itanagar. I scheduled my consultancy 2 hours before the movie so that there's no last moment rush. So the second patient of my day is a simple third molar extraction. While you are extracting a third molar extraction, it is always important to check the status of the adjacent tooth, that is the second molar status. The second molar here had grade 1 mobility. Also you can see that in such case there is the absence of the first molar as well. So here there is high chance that it can cause post-operative mobility of the second molar. So therefore, in such cases, always I will advise you that you should use a forceps if you are not expert with the elevators. I have removed the third molar here with a luxator. So that comes to the end of my video. Thank you so much guys for watching my video. Please do not forget to like, share, subscribe and comment, because as smooth as the video looks, it isn't that smooth. It takes a ton of hard work. So please don't forget to like, share, subscribe and comment, and if you have any doubts we can discuss it in the comment section. Thank you.